start with. But where I thought would be useful to start with was defining the term mental health first, okay? Because many a times in workshops, I've asked groups the question, when you hear the term mental health, what's the first thing that comes to mind? And you can imagine, right, that most people will automatically think depression, stress, anxiety. Some groups have even said things like psychosis or schizophrenia, which is interesting because they're actually very serious forms of mental illness. And it's particularly interesting, I find, because if I use the term physical health, they don't automatically think about diabetes and cardiovascular disease. So I think there's these connotations with mental health, or at least, many people treat mental health as a synonym for mental illness. Which then, if we extend that to the definition of a mentally healthy workplace, then most people, if they're thinking about mental health being about illness, it's about then, stigma reduction. Like, how do we get people comfortable talking about it if they've got a mental illness? How do we get people having peer-to-peer conversations if they're concerned that someone's not right? And I find those things, whilst useful, are very much in the reactive end. Right. What we want to do is to be more preventative. Like, how do we actually prevent someone from getting ill in the first place? Yeah. And that's why I guess I've been drawn more to this field of psychological health and safety and definitions around that term. And you'll probably hear us use that term, a psychologically healthy and safe workplace, more so than a mentally healthy workplace, because of the reasons I just explained. But I really like the definition from the Canadian standard about a psychologically healthy and safe workplace. It's one that promotes workers' psychological well-being and actively works to prevent harm to worker psychological health, including in negligent, reckless, or intentional ways. So basically, what it's saying is we need to have things that promote the positive, like how do we improve worker well-being, but also how do we prevent harm, which then brings into play things like risk management, identifying and mitigating hazards. Now, if you want the formal definition of mental health from the World Health Organization, it's a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So not a single bit in there about illness. It's more focused on the well-being, and the national standard of Canada does focus on more the positive aspects as well, and harm prevention and well-being promotion.
Yep.
And what again, the other thing I really like about this is if you think about mentally healthy workplace as one that's purely there to accept people who have a mental illness and reduce stigma, it doesn't actually make a high bar for employers to cross. If all you have to do is accept people with a mental illness, I think most organisations can do that. But if you actually need to have a documented process on how you're going to identify and mitigate hazards, and then monitor those over time, and then use a continuous improvement approach. Obviously, this actually requires a fair bit more of employers. And maybe to date, maybe that's why we haven't seen so much of employers actually doing that of their own volition.